Couples who are having a hard time conceiving a child may turn to extreme measures, but do some of these odd tricks perhaps work to boost fertility? Dr. Anthony Propst is here from the Texas Fertility Center with some answers for us. Good morning, doctor. Thanks for joining us.
Good morning, Amanda.
First, we're going to talk about foods, and there are a few odd things that we read about. Will eating dark chocolate every day help you get pregnant? This is the most strange one I've ever seen. Will eating McDonald's French fries boost your fertility? Not exactly kind of specific foods, I would think.
Well, we all enjoy the McDonald's French fries, and but we don't know that those specifically will help with fertility. But I have lots of patients who have certain tricks, whether it's eating pineapple or wearing their lucky socks, that they feel gives them a better chance of getting pregnant. And we encourage that, but at the same time, you need to be taking proactive measures to help you conceive.
So in reality, what can couples do to boost fertility?
Well, the most important thing is to have a healthy diet, to try and be a normal weight. Women who are underweight or obese have a more difficult time conceiving. The other important thing is to have frequent intercourse during that fertile window. There's about 5 days before you ovulate. That is when you have the chances of getting pregnant. So frequent intercourse during that time is a way to boost your fertility.
And let's talk a little bit about stress. I've read that maybe that affects fertility?
Yes, stress can affect fertility, especially high levels of stress or being very low body weight can affect whether or not you ovulate. So anything you can do to decrease stress and have a regular cycle will improve your chances of getting pregnant.
Is there something you shouldn't do?
Well, there are definitely some things you shouldn't do, and those particularly are lifestyle. So smoking can affect fertility both for men and for women. Heavy use of alcohol or caffeine can also affect your fertility.
At what point do we need to get tested?
For women who are less than 35 and who are having regular cycles, it's reasonable to give about a year chance to get pregnant. If you haven't gotten pregnant within a year, then you should seek help from a fertility specialist. When you get older, women typically over 35, the chances of fertility are reduced. So at 6 months, if you haven't gotten pregnant, if you're over 35, you should seek help from a fertility specialist.
Do you see a lot of these cases?
We do. We see lots of patients who need help getting pregnant. About 15 or 20% of women or couples will have infertility. So it's very common to need help. And there are fertility specialists, OBGYNs, and reproductive endocrinologists such as myself who are there to help you.
How long does it take to perhaps get pregnant?
I have patients who get pregnant a week after seeing me. I have patients that it takes several years. So it really depends on the cause of the infertility and the treatment that you need. But most couples who seek treatment for fertility will become parents.
Do you suggest being patient?
Patience is important, but also seeking care so that you can get the help you need if you're suffering from infertility.
All right, Dr. Anthony Propst from the Texas Fertility Center. Thank you so much.
Thank you, Amanda.
We're going to be right back.